Okay, good evening, everybody, and welcome to the Gyaan Vardhini session number 22. I am Anand from Cleansap team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. So before we begin, I would like to share a brief overview of the amazing Cleansap app that we have developed over the last 6+ years. Cleansap means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full or 100% offline mode. It has a very simple design. ClinSav helps doctors easily manage patients, appointments, case papers, full prescriptions, bills, fees, issue of pre-filled letters, manage finances, and doing follow-ups with patients for any outstanding dues. ClinSav also sends automated appointment reminders 1 day in advance to your patients through SMS, and it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. Now we shall start with our today's webinar. Our today's webinar topic is Vimukti, Freedom from Addiction with Ayurveda. Our distinguished speaker for today is Dr. Jaina Patwa. We are delighted to welcome Rotarian Dr. Jaina Patwa, a NABH accredited Ayurvedic physician with over 16 plus years of clinical practice. She is the founder of Vishwacare, a global Ayurveda platform offering personalized consultations, customized treatments, and innovative holistic products for health, beauty, and wellness. Dr. Jaina's journey in Ayurveda began with her studies at a leading MUHS affiliated college in Pune, followed by advanced training under renowned Vaidyas. Over the years, she has integrated Ayurveda with yoga, Reiki, meditation, Marma therapy, and global healing practices. Her passion is to make Ayurveda accessible and practical, not just as a treatment, but as a way of conscious living. She is a member of the Ayurveda Association Academy UK and Nasya India, affiliated with Ayush, extending her contribution to Ayurveda on both national and international platforms. She has represented Ayurveda at the World Neem Organization, the Yongdeok Wellness Festa in South Korea, and is soon to host a women's wellness retreat in Sri Lanka. Through Vishwacare, she has touched lives across the globe. Beyond clinical practice, Dr. Jaina curates signature retreats, wellness programs, and student mentorships, empowering the next generation of Ayurveda doctors and enthusiasts to carry forward this timeless science with authenticity and innovation. She is currently mentoring a student from Switzerland who came to Mumbai especially to learn Ayurveda from her, and is associated with Ayurveda enthusiasts worldwide to spread the wisdom of her ancient science. She is also a proud Rotarian and public image director of the Rotary Club of Addiction Prevention, where she actively works on integrating Ayurveda into mental health and addiction prevention. Today, she brings to us Vimukti, freedom from addiction with Ayurveda, a heartfelt initiative to guide us in overcoming modern dependencies, from digital distractions to substance abuse through the holistic lens of Ayurveda. Dr. Jaina, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Jaina Patwa for today's session. Dear ma'am, you can start with your session now.
Thank you so very much, Mr. Anand, and thank you, Gyaan Vardhini, for such a wonderful opportunity to present this Vimukti, Freedom from Addiction with Ayurveda. So this is going to be a comprehensive clinical webinar where we're going to take a lot of points, making sure that we are covering up everything that our Ayurveda doctors, students, and the wellness enthusiasts can take care of. Next slide, please. So we would start with our Lord Dhanvantari mantra. Om Dhanvantaraye Namaha. Namaste, I'm Rotarian Dr. Jaina Patwa, founder of Vishwacare, Mumbai, and public image director at the Rotary E-Club of Addiction Prevention. Today, we will explore what addiction is, why it begins, how it manifests, and how Ayurveda can intervene, from early detection to complete treatment. My objective is to give you a practical Ayurvedic toolkit for patient care, holistic intervention, and long-term recovery. So let's begin with knowing what actually addiction means. So addiction is a chronic condition where a person repeatedly seeks a substance or behavior, even knowing it causes harm. So in Ayurveda, it is actually the imbalance of mind, body, and spirit, which weakens the antakaran, the three internal instruments of mind, which is the dhi being the intellect, triti being the willpower or self-restraint, and smriti meaning the memory. This webinar blends Ayurvedic wisdom with modern science, showing that addiction involves neurotransmitter imbalance, cognitive impairments, and altered neuroplasticity, making behaviors compulsive and persistent. Next slide, please. So let's know the recent research data which the WHO has published about the global addiction. Alcohol, uh, approx 400 million adults are affected, approx 2.6 million deaths per year. Heavy drinking risks liver disease, accidents, and mental health issues. Drug use, approx 296 million people use drugs, approx zero point 0.6 million deaths per year. Opioids, cannabis, and stimulants cause physical, mental, and social harm. Youth exposure, approx 50% of the 15-year-olds tried alcohol, 20 to 30% tried e-cigarettes. Early exposure increases long-term addiction risk. And the treatment gap. Let's also focus on this because that is also something which really we all doctors need to work on. So less than 14% of people with alcohol problems receive help because of ample of factors, one being stigma, one is the lack of access, and low awareness prevent recovery. Next slide. So now let's focus on knowing like what is the actually classical and historical insights on addiction. So we all know that addiction has been there since years together. It's recognized across cultures for thousands of years. May it be alcohol, may it be opium, may it be cannabis. So the term addiction is from Latin, which means to devote or to be bound. Manusmriti also has the reference of addiction, wherein it speaks about it warns against excessive sensory indulgence, may it be hunting, overeating, and also sleep. So people do not feel that sleep is also addiction, but day sleep specifically, that is also one kind of addiction. Bhagavad Gita also has a reference which is about promoting self-control, mindfulness, and sattvic living. Historically seen as moral weakness, but today, so that time actually it was taken as a stigma, as a moral weakness. It was not a disease for people. But luckily in 19th century, addiction recognized as a treatable medical condition. In the 20th century, rise of support groups like Alcoholics Anonymous and understanding as addiction as a problem. So glad that today where we are blessed to be in this space wherein addiction is considered as a complex chronic brain and behavioral disease requiring holistic treatment. Next. There are a lot of references even in the Ayurveda classical texts on addiction. So as you can see here, Charak Samhita speaks about it in the Chikitsa Sthan chapter 24 after the Vish Chikitsa. It speaks about the properties, stages, dosha, treatments, everything. Then Sushrut Samhita also has the reference which you can find in Uttar Tantra chapter 47. It's about the management withdrawal. And Ashtang Hriday and Sangraha also has its reference at the Chikitsa Sthan wherein it's spoken is the intoxication, the mother, and unconsciousness, Mulsha. Bhav Prakash speaks about the mental disorders, intoxication symptoms, and Yog Ratnakar has a dedicated chapter on Madhyathyay, which is the treatment for alcoholism. Now let's know that what are the causes of addiction. So there are various causes, but let's focus on something which we really need to know at this moment. The first and foremost I would speak about is the inner imbalance and emotional void. That feeling of emptiness which is growing gradually because of the digital time where we are, or the inability to cope with emotions. Then it's all about stress and trauma. This is also a very big factor. So whenever you consult your patient or you're treating somebody, make sure you are checking on the history, knowing all the past experiences the patient has had. Any traumatic past or ongoing experiences will definitely increase the vulnerability. Neurological factors, which is about the dysregulation of dopamine and serotonin pathways, leading to compulsive reward seeking. So this is also very important right now, especially we will see to this in the digital addiction. Actually, the reward seeking dysregulation of the hormones is one of the key factors that we really need to work on. Then it's the genetics and environment. The family history, peer influence, and lifestyle factors contribute to it. Mental health issue, which is anxiety, depression, or other psychiatric conditions can predispose to addiction. Behavioral patterns. So as we saw that so we're going to see further, there are two types. So one is the most important, which is behavioral patterns. So habitual engagement with rewarding stimuli, may it be substances, may it be digital devices, may it be gambling. It reinforces dependency. Let's understand the Ayurvedic pathophysiology for addiction. That really what goes wrong in the body according to Ayurveda, which actually impacts and creates this addiction. So, as we all know, that addiction is not a one day game at all. It has been there since so very long, and finally, it's reached at that state wherein a person is not able to live without it. So, the first and foremost thing which is important to focus is the weakening of mental powers, meaning the three musical instruments which I told you previously, the Dhi, Dhriti, and Smriti. These about the intellect and clear thinking, which literally starts diminishing. Dhriti, which is the willpower and self control, that also starts getting weakened. And the smriti meaning memory, learning from experience. So this definitely, as we all know, it definitely goes down the drain, as a person starts getting used to some kind of behavior or some kind of substances. As we all know in Ayurveda, that is actually rightly said that the dhriti smriti vinashyanti tridoshaha samyam karoti. Meaning that when there's imbalance in these three mental powers, it immediately starts hampering all the three doshas, not just one. So, because of that, the vata, pitta, kapha are imbalanced. Along with that, it also gets the mind also gets imbalanced. Your sattva decreases, your rajas and tamas gets disturbed. It actually starts aggravating in your body, and because of that, then is the intellectual error, wherein it's spoken very very well in Ayurveda books about the prajna, which means the wrong choices disrupt natural life flow. So the person actually starts being not wise enough to know what is really good for them and what is not. And because of that, the errors that they are making, may it be the lifestyle, may it be diet, may it be the mental wellness, whatsoever, it starts creating armor, which is the toxins in the body. These toxins, what they do is they block the energy channels. They start the strotas avrod is what we call. And because of the blockage, the nutrition does not get through all throughout the channels, and because each and every cell is not actually vitalized, because of that the ojas also starts getting diminished. It depletes the ojas level, which is the vitality. And after that, all the three main energies, which is the tejas and prana and the ojas, all these three are diminished. Tejas meaning the metabolic energy, prana meaning the life force. So all these three important energies starts getting depleted. After these three energies actually starts getting depleted, obviously nothing is really in the right balance, not mentally, not physically, not emotionally, neither of the ways. So after that, you can start seeing the effect, which is about cravings, loss of control, physical, mental, spiritual disharmony. Next slide, please. Now we are going to talk about the types of addiction. So as I said, there are two main types of addiction. There are too many, but everything you can categorize mainly into two types. One is the substance addiction and one is the behavioral addiction. Substance addiction means that physical dependence on chemicals such as alcohol, tobacco, opioids, or drugs. And this alters brain chemistry, and this leads to withdrawal symptoms. Second is the behavioral addiction, which is about the compulsive behaviors like gambling. excessive internet use, shopping, or sexual compulsivity. This activates the brain's reward system, similarly to substances, as we spoke about before. That right now, because of this emotional void, what is happening is everybody's wanting to fill it up with something. And that something is definitely to place themselves at a place where they can see and be happy with. So, where you can see actually yourself happy is when you start getting feeling rewarded. May it be right or wrong, that's a secondary thing for anybody at that moment, because they're so much emotionally taken down. So at that moment, any kind of reward that is coming to them is actually something that they start getting used to. And that is how the behavior starts getting a pattern rather than just one single behavior. So let's understand what happens after this addiction that happens. So the progression and consequences of these two addictions would be, initially, it provides temporary pleasure, confidence, or excitement. And the confidence also, so even if you see somebody who started again, I mean, suddenly being very confident, so brave, which they were never there. This is also one of the sign you can start understanding that there is some shift, right? Some transition. Then over time causes physical issues. So once the person starts getting used to, as we understood that, your three doshas are imbalanced, your mind is imbalanced, everything. So as Ayurveda speaks that the main key factor of any problem is your agni, right? Your fire, digestive fire. So that starts getting diminished, leading to poor digestion, malnutrition. The further cases right now that we are seeing in so many people is infertility, right? Even gynecomastia is getting common these days. Then the mental effects. So the cognitive disturbances, compulsive thoughts, mania, anxiety, these are the effects you would start seeing in people. This not only affects them, but I always feel that it impacts the overall life, relationships, and health. It takes down everything, because at that moment, the person is not in that state at all to understand anybody, and they always wanting to seek something, right? So that is the time. Definitely, we being in Ayurveda holistic treatment, we can definitely have a very wide approach, which we'll see to it after a while. Next slide. So let's understand that addiction, the prevention is what we focus the most, as Ayurveda always speaks about that prevention is better than cure. And first and foremost step would be prevention. As you start seeing the early signs, the warning signs, you start knowing and you start treating them there itself, making sure that the person does not get into that phase at all. So there are very simple and very easy choices that a person can make at that moment, which you can recommend to your patients. The first and foremost would be a healthy diet, right? Which is going to balance all the three doshas. And along with that, make sure that the person is not just having healthy diet, but also following a regular timing. This is something which actually is missing everywhere. People are not able to align themselves with the circadian rhythm, right? So make sure that the patient is eating healthy food, having food on time, and also following the circadian rhythm. Then the important step would be strengthening the sattva, the mental clarity, and also working on nourishing the ojas, vitality. This can be done very easily through meditation, mantra chanting, music therapy, or gratitude rituals. So that's the reason to strengthen the sattva, the best and easy, which everybody knows right now, is to follow a sattvic diet, which is mainly about warm foods, which is freshly made, homemade, intake of ghee, fresh fruits, whole grains, eating on time, as we've spoken about, and occasional fasting. So, occasional fasting, as Langan Chikitsa and Ayurveda is having such a huge importance. Depending on how the patient is, depending on that is what you can recommend the fasting. Then avoid stale, processed, overly spicy, or oily foods, because any of these things would definitely increase the rajas and tamas. And because of this, mainly the three musical instruments which we've spoken about, the Dhriti Smriti. The Dhriti is the one which gets the weak the most because of all of these. And Dhriti is a very important thing that we need to focus on, because it's about the willpower, right? It is about the self-restraint. It is gonna stop you from going towards the something which is really not good for you, right? Now, maintaining dinacharya, which is about a daily lifestyle, Ayurvedic lifestyle. like early rising, maintaining hygiene, balanced sleep, and regular physical activity. So all these things, if are taken care of, definitely, sorry, just a second. So definitely, you can see the change, right? Also practice yoga and pranayam to manage stress and emotional triggers. So as we understood that addiction is not just about the physical health, it is a actually triad, which is about physical, mental, and spiritual, right? So if we are supposed to focus on all the three things, we have to make sure that we are taking on each and every recommendation which we spoke about right now. And along with these things, next slide, please. And along with these things, it's not just about the person, right? It is also about the family. Dr. Snehal, can you do the next slide? It is also about the family, right? So avoid environments, habits, and associations that encourage substance use. Next slide. So it's very important to seek family and community support for guidance and accountability.
Sorry,
Use
ma'am.
new.
Actually, my laptop is stuck. Just let me.
Sure, no problem. You can take your time, no problem. So, as we'd spoken about that family, be staying with family, being with them, discussing your problems, telling them, what actually they've been facing, having a friend circle who is there to understand you, who's able to help you, able to make you differentiate between what is really good for you and what is not, right? So, this kind of family and community support really makes a very huge difference. Along with this, we can also recommend a few neuroprotective herbs, simple ones like ashwagandha, brahmi, shankapushpi, to calm and stabilize the nervous system. Engage in creative or skill building activities to channel energy constructively and reduce boredom driven cravings. So, as we know that right now people are so much focused on maybe the things which is satisfying them, they're actually staying apart from something that they're really good at. Actually the creative skills are missing currently. So you can definitely see to it that what they really love, what do they really like, and make sure that they're doing that activity, which I also do with all my patients. I always ask them, what do you love the most? So if they have to say that I like music, so I always make sure that how much do you really listen to, or how much do you really sing, and they have to tell me, no, I don't do it very often. I don't find time. So I feel this is something that we have to speak about, that whatever we love the most, at least we can take out maybe at least half an hour or 1 hour from our every day, or maybe at least alternate days, to make sure that we are channelizing our energy in a very constructive way, right? Then it is about the regular self reflection and journaling to track moods, triggers, and progress, enhancing self awareness and emotional resilience. Next, let's understand what are the Ayurvedic treatment principles for addiction. So, the first and foremost, as we all know, it starts with a Shodhan Chikitsa, which is a detox, right? So, which would be about the Panchkarma and Upakarma therapies to remove toxins and balance the doshas. The second step would be pacification, meaning using the appropriate Ayurvedic herbs and minerals to calm the mind and reduce cravings. The third one would be the rejuvenation Rasayan Chikitsa. This is also a very important part which many people are missing these days. That there are various kind of herbal ghees, lehams, medicated jams to restore vitality. But in the current situation that I see, people are, I mean, I don't know why they're not wanting to take that. Rather, they are wanting to switch over to vitamins, supplements, and everything. I'm not discouraging that fact. The vitamins are also good in its own way, but it is not enough, right? You also need to have something which is gonna rejuvenate your cells, your body. Then the fourth thing is mental healing, the Satvavajaya Chikitsa, which is about counseling, meditation, yoga, spiritual practices to strengthen your mind and willpower. Then is the diet and lifestyle, the sattvic routines and practices to prevent relapse. So, Ayurvedic treatment is a personalized based treatment which is based on age, place. pulse, prakriti, dosha imbalance, mental emotional state, addiction severity, physical health, diet, lifestyle, environment, family support, and history. So you really need to make sure that you are figuring out each and every basic thing that we cannot miss, so that we understand the person wholly and solely and can actually give them the correct treatment then. Now let's start the topic, which is a very crucial one in this time where we belong to, which is the digital addiction and Ayurveda. So, what is digital addiction? It is a compulsive use of digital devices, which causes cognitive, emotional, physical, and social issues. You are very much seeing these days everybody suffering from anxiety, depression, insomnia, eye strain, especially dry eye syndrome is increasing tremendously in each and every age factor. Poor posture, social withdrawal, reduced focus, and memory lapses. So let's understand what is the neurological basis of this. So basically, overactivation of dopamine pathways. It reinforces compulsive behavior. It also disrupts the serotonin balance, and it affects sleep and impairs attention, learning, and emotional regulation. Now let's understand this in an Ayurveda way. So what are the Ayurvedic insights? Would be that the first and foremost would be the Vata and Pitta would be aggravated in such people. Because of that, you can constantly see them feeling very restless and irritable. Because of this, gradually you can start seeing that also it starts affecting the kapha dosha, right? And the kapha starts aggravating a lot too. And because of that, people are just wanting to take the phone and lie down or just sit for hours and hours, which actually induces lethargy, reduced motivation. And because of all these, again, the sattva gets depleted. Talking about the poor mental clarity, affecting the Agni and Ojas disruption, which is weak digestion, memory, and vitality. This again, as we studied before about the pathophysiology, the similar thing is applicable here as well. So the intellectual error, which again push them towards repeated indulgence. Okay. Now let's know that what are the early warning signs. So anxiety when offline. So when they know that okay, I'm not gonna get my phone for a few hours or a few for a even when they're working, they're wanting the phone in their hand all the time. So this is something which is a early warning sign. Then sleep disruption. Sleep definitely goes down the toss because because of the blue light continuously. People are now used to taking phone in hand and sleeping, right? And the phone does not get shut at all till the last minute of their sleep starts inducing, right? So because of the blue light radiation, literally it affects the sleep cycle completely, and because of that, even the eye strain, the dry eyes, which I spoke about, is what is getting common. Headaches, poor focus, memory lapses, and withdrawal. Now let's understand how can we manage digital addiction. So Nidan Parivarjan, Ayurveda always speaks about that focus on the cause, the root cause, that what is actually the reason of this problem. So understanding that, definitely rule out that the first thing. And secondly, also limit device use. Also, digital detox is something which people are now wanting to focus on, and there are many people spreading this word across. So digital detox is very necessary. Then comes the panchkarma and upakarma. Mainly for digital addiction, as it is about starts with, so the digital addiction, it starts definitely with the eyes, right? The first thing is what your eye is seeing. So the first thing that I always recommend is the Netra Tarpan, the Panchkarma treatment. Then it starts also affecting your mind, right? Your brain stimulation. So Shirodhara is important. Nasya is important because Nasya definitely works the best on your brain. Then Abhyanga is basically to control, to manage the Vata influence, the restlessness. And Basti also works wonders, specifically when you see the patient is having a lot of irritability and restlessness. Then Basti is what you can recommend. Then speaking about the Medhya Rasayana and Ayurvedic medicines, Brahmi Ghrita, Shankapushpi, Ashwagandha. Guduchi, Ashwatha, meaning the people, and Suvarnaprashan, especially for children, and Sona Chandi Chavanprash for adults. So let me also give you a very small tip that the people leaf, the Ashwatha which I'm talking about, I usually recommend it along with Suvarnaprashan to all my patients, to children specifically. What you need to ask them to do is that pluck a freshly new leaf of people, Ashwatha, and in the morning itself, don't keep it overnight, and just wash and make a juice of it and add some ghee and honey to it. Give just 1 to 2 spoons of this to your children, even you can have it or even you can recommend it. This really works on the brain level so very well that it increases the sattva, right? It balances the rajas and tamas. Okay, so this is something that you can recommend. Again, along with the medicines, as we saw, it is also about the mental healing phase, which is about counseling, meditation, mantra chanting, mindfulness, and gratitude practices. I believe a lot in gratitude practices. Just to speak a bit about gratitude, I usually start my morning with a prayer followed by the gratitude ritual. So let me tell you why the gratitude is really so necessary in this time, because I feel that when you are content with your life, right? When you are happy and you're content, and when you are really grateful for whatever you have, you start seeing the brighter side of the picture, right? It is always that you should start see to the fuller glass rather than the half glass, right? I mean the full space, not the empty space of the glass, right? So I feel gratitude is what actually starts making us understand. So make sure that you do it yourself, and you also recommend everybody to do a gratitude ritual every single day, specifically in the morning time and once at night. Then lifestyle and preventive. Uh, so dinacharya, yoga, pranayam, and along with that a structured routine, because when there is a routine, a structured, how we used to have before, I feel in the school times, I used to always make a timetable for me. Okay, this is the time for me to do this. I feel that is how I used to always follow it. But right now, what happens that because of the unstructured routine, people always have that empty space in between. And the empty space means only one thing, that people would take their phone in hand and then keep doom scrolling, right? So I feel if it is structured, it would help better. Then outdoor activities, as we were speaking about initially, that you need to focus on your skills, right? Your creative talents, your something that you really want to learn and explore. This is what would rewire the system again. So definitely need to focus on that. And along with that, last but not the least, is the family support, right? Then next slide. So this is just for you to have a knowledge about that the psychotherapy and pharmaceuticals, which is the cognitive behavioral therapy, motivational enhancement therapy, dialectical behavior therapy, and selective serotonin reuptake inhibitors, naltrexone. These are the usually therapies and treatments which uh, the regular doctors they usually recommend or prescribe. This is just for your reference that when a person is coming who's already suffering, and then the prescription has this, you already know about these things, in case if you don't know. Now, the long term effects. This is also something which we need to focus. Right now, digital dementia. So, as we all know, that dementia is one of the major focal point where we are seeing not only India or just one part of the world, but everywhere it is spread. So, dementia is usually seen in the elderlies, right? But right now, because of the digital screen all the time, your mind, your brain is not able to focus, is not able to function the way it is. You're getting so dependent on something, even AI right now. People are getting so used to it that they have stopped thinking. That is where the digital dementia is actually get seeping in. Then social jet lag, right? So you do not know about, the timing at all. So you're not able to focus on the circadian rhythm at all. Like if you are sitting with your phone and it's already an hour or two, you don't know the time at all. You don't know, like, if it's afternoon or it is evening. So that is something which we need to focus on. Then is the neck tech syndrome. Neck tech syndrome meaning that because all the time, our face is on the screen, which is usually in our hand, we are sitting like that, right? So because of that, the neck completely in this position for hours and hours. And because of that, the cervical spine that we have here, which is not very prominent, starts getting prominent. So this is something you can, if a person is digitally addicted, you can check is this part, how prominent it is. So you will get an idea that how much the person is using the phone. And mental autism. Uh, Unfortunately, autism, we all know the signs and symptoms already, but this is again getting into the people who are getting used to digital media. This is also something which is very unfortunate, and I hope that we can work on this, make sure that it does not get it to that stage ever. Now, the evidence is Ayurvedic therapies improve cognition, mental clarity, and reduce addiction severity. So there's a lot of research which has happened and has been happening. You can definitely take help of Perplexity app. It gives you the research data of everything. So you can see that from mantras to mudras to the music therapy, the frequencies, to the simple panchkarma therapies, to the Ayurveda herbs. Research is done on everything. For example, just to let you know that Om chanting is so very important. There's actually research done on that as well. Like there were two batch of students, one batch, same standard, same everything same, same teacher, same school, everything. So one batch was made do the Omkar chanting every single day, okay, for a month. And one batch were not done anything, they were following the rest of the routine. Just after, literally just after a month, when the examination was placed, the first batch was which was practicing Omkar every day, performed so very well compared to the second batch. So this itself means that even a small uh, behavior that we add on, we adapt to, which is good for us, would really bring us such a huge change. Then real life example, we all know about Elon Musk. We all know that he did report about screen overuse, which is impacting his sleep, focus, and emotional balance. And because of that, he definitely took it down. And today he's really happy to be in a space where he was much before. So he's one of a real life example for all of us. Next slide. So now we are gonna start with the second topic, which is very, very important. It is about the alcohol addiction. So let's understand alcohol addiction. What does it really mean? This is also compulsive alcohol use, even despite knowing the harm, causing tolerance, withdrawal, organ damage, especially liver, cognitive and emotional disturbances, and social conflicts. So let's understand what brain chemistry is really going wrong there. So it is about the alcohol that's metabolized. So when we have alcohol, okay, orally, it gets into the system, the digestive tract, and it starts producing acetic acid. Okay. So this acetic acid then gets metabolized to acetaldehyde. Now we all know that acetaldehyde has such toxic effects on liver. 90% of alcohol actually is taken up by liver, literally. So that's the reason the first and foremost it impacts his liver. And after that, because of the liver, which is your digestive, stimulant, it goes down. It starts hampering the rest of the organs as well, especially the nervous system. This alters the dopamine and GABA and serotonin pathways, which definitely make sure that you are depending, you are having the cravings, and the withdrawal symptoms are also highly seen. And then just to clarify one more thing here, that 90% of the consumption of alcohol, as I spoke about, is by liver, right? But the 10%, the rest is actually taken out from the body through your breath, urine, and sweat. So that's the reason, the symptoms that we always see that how the person is smelling. Is it really that strong enough? Then definitely the intake of alcohol you yourself will understand is so higher. How's the breath? You can just keep a check on all of it. Let's understand the Ayurvedic insights for alcohol addiction. So, the first and foremost thing which really gets impacted in the three dosha is the pitta aggravation. So, because the pitta gets aggravated, it starts causing inflammation and tissue damage. After the pitta, the vata also starts getting disturbed, affecting the nervous system disruption. And then the toxins are built up, which again starts blocking the channels, impaired digestion. Then the sattva and ojas, the depletion is there, which is about the emotional instability, immune weakness, and then the intellectual error, which is about the repeated indulgence, even after knowing how bad it is. Next slide. So now let's know like what are the signs and symptoms literally that you can take care of. One is the mental signs and symptoms, being cravings, anxiety, irritability, poor focus. Physical symptoms would be liver dysfunction, poor digestion, digestive issues, fatigue, low immune system. Then social would be the family disputes, work or school problems, isolation. So as I told about, the mental autism, you can start seeing a few signs here as well, the isolation. They try to keep themselves, all aloof. And that is also one of the reason that it gets triggered much more. The early warning signs would be cravings, then excessive drinking, even the secret drinking, where they know that family is not okay with, they would do it when people don't know about it, right? So it's very important to know about that as well, so to understand like how the family harmony is, how the person is handling and dealing with things. Then is the mood swings. As we spoke about irritability, anxiety, depression, too many different kind of moods that you can see in them. Then is the tolerance. The level of tolerance literally goes very down. Even a small little thing, they are not wanting to understand at all. They are just wanting to go to the extremes, literally. Then the mild withdrawal, um, and the social withdrawal. So these are the early warning signs that one can focus on. Now knowing how we can manage this, literally. So as we spoke, it's a similar thing as well here as well. The first point would be the Nidan Parivarjan, which is about knowing the root cause of it and making sure. So very frankly, any kind of addiction case that comes, I feel the first and foremost thing, rather than just being a doctor to consult, the first thing would be counseling, to really understanding them in each and every possible way that actually what is the main problem? What is the reason that this even began with? And why is this person also continuing with, or when it really gets triggered? So we'll be able to reach out to the actual cause and we'll be able to start making them understand and start you know treating that literally, right? So gradual reduction, avoid triggers is what we can focus on. Then is the panchkarma and upakarma. As we all know that because of the pitta getting aggravated, the first and foremost thing we need to focus would be the virechana therapy. Then also the vata, as we know, that gets imbalanced, basti is a very important thing. Let me tell you something very important about basti therapy. So I definitely had a patient who was suffering from alcoholism, and he really did not wish to stop it completely because of the withdrawal symptoms, scare, fear that how will I be able to do it? Will be really that working for me? So when I had to make sure that the family support and everything is really well placed, I told him, you really wish to do it, I will definitely help you further. Okay. So what we did is we actually started giving them him basti with the type of alcohol he was consuming. So one more thing, make sure that you know what kind of alcohol the person is taking, because that also plays a very huge role. Okay. So the same alcohol what the patient was consuming every day, we started using that for the basti therapy. So it was a combination of milk and the alcohol, being the alcohol, say like a 50 ml, and the milk is 200 ml. So the total mixture would be 250, right? Gradually making it 40 and 30, 20, 10, and nil, right? So automatically the withdrawal symptoms are very hardly seen. So this is something that you can use. Then Nasya is definitely a very important thing, as we know that we need to work on the brain chemistry, right? And Shirodhara and Abhyanga and the Rakta Mokshan. So Rakta Mokshan, we did not speak in the digital one because it was not orally consumed, as we all know. Rakta Mokshan plays a very huge role again in this addiction, alcohol addiction cases. Because as we all know that when the pitta gets aggravated, the first and foremost thing, the dhatu it's going to impact is going to be the Rakta dhatu, right? So we need to be very sure that the impure blood, the rakta, comes out of the body. So that detox also starts helping the patient much more. So you can do both together as well, one after the other, Basti and Rakta Mokshan, along with the rest of the Panchkarma therapies. Then is the Ayurvedic medicine and the Rasayan therapy treatment. Avipatika Churna, we all know, works wonders for the balancing the pitta. Then Ashwagandha Arisht, it works very well because it is a fermented tonic. It literally, the body already knows the fermented stuff, right? So it blends very well in the body. It assimilates and starts working on health. Then Brahmi, Ringraj, Suvarna Sudshekar. So Suvarna Sudshekar is also a very wonderful drug. One more thing I would like to mention here is wherein you feel the case is very challenging. What you can do is you can use the Suvarna Sudshekar tablet. You can fill it up in a onion and you can literally burn the entire onion. Okay. And then you just make a powder of it and you give that to the patient as a medicine in a very small dosage every single day. I have literally seen that there are amazing results with this particular thing. Then very important, one more thing would be the Kushmand Avleha. Why Kushmand Avleha? Let me clarify because there are a lot of herbal jams available, right? Why I have mentioned only this one for now is as we know that when the pitta gets aggravated in the body, the main symptom of the pitta would be what? The body heat, right? So not just for working as a rejuvenator, but it's also working on the digestion. It's also working on balancing the pitta. It's also working on the brain. So it's working in each and every way, that the symptoms that we are seeing for alcohol or alcoholism. Then the herbs like Jatamansi, Sarpagandha, and Vacha, these also really works beautifully. So you can use them as well. Next. Now, as we all know, after the treatment and everything, what is the important thing? It is the mental healing, right? So similarly, make sure that you are recommending them sattvic lifestyle and diet and structured routine, and the family support is really there. Now that I'm talking about family support, one more important point that I would like to mention here, that there are many patients who actually, not patients, but the family people who actually, come to me or they call me. They have to tell me that my husband or my XYZ, they tutors and I don't know really how to help. And I feel that if you could help me to give him some medicine he does not understand, and can I help him that way? Let me tell you that that does not help at all, right? That driti, the willpower, is something which is affected the most in this cases. And if the person does not know, obviously the willpower is not going to be there ever, right? So we have to be very sure that the person, we tell the patient's relative that don't worry, you bring your, relative. So make sure that it is a combination of everything. Only now coming to the main point, pharmaceuticals, as we all know that prescribed medicines which are usually given by the doctors. Again, I always focus not on just Ayurveda or not on modern science. I feel these kind of cases, which is so difficult to take care, integrated wellness, healing, treatments works wonders. So make sure that even the patient is on this, you know what kind of medicines you are giving along with, and you can definitely integrate it together. Now, knowing the long term effects. Long-term effects would be the liver cirrhosis, neuropathy, cognitive decline, emotional instability, social and occupational dysfunction. This is something we can focus on. As we all know that liver is the first and foremost thing which starts getting affected. So make sure that and it is much more easier to reverse it, right? Then coming to the evidence, clinical studies, liver health, mental clarity, and reducing relapse risk. So life example, and he realized the challenges, with it. And after of alcohol addiction and make sure it happens. Important. Next line about tobacco, I'm sure. So again, cigarettes, BDs, gutkha, kaini, in whichever form it is, despite knowing the harm, right? Nicotine drives dependence. Obviously, as the definition itself speaks, let me tell you that the first and foremost thing that you check would be the oral lesions, right? So they usually lung disease. So when you are doing, you can definitely use your stethoscope to see, So nicotine, it activates the brain reward circuits. Dopamine and chronic use injures and withdrawal being anxiety, irritability, and insomnia. Now the Ayurveda insights. So the first and foremost thing, complain about burning in the chest, about the oral. So usually you can also see their face also a little inflamed. Um, then the next thing after the pitta is aggravated would be the vata aggravation. Then kapha aggravation, you can see symptoms like mucus, lethargy, the ama buildup, wherein it is sticky. So you can very dry, placed, which doshas impacted the most. After the three dosha imbalance, the dhatu gets depleted. Okay, specifically the most important being the shukra and because the shukra dhatu getting diminished. So you can see lowered vitality, fertility issues, cognition. Um, the intellectual error caused by it. So the weakened willpower, repeated indulgence, and frequent urination. specifically in many people that I've seen. So that again, they speak a lot about, which stage they are at about tobacco addiction, right? I always believe not necessarily the patient also always wants to tell the truth. Maybe they somewhere know. For example, if I'm smoking like 20 cigarettes a day, they know that this is not a good thing. So then they feel, oh, is the doctor start gonna judge me? Or maybe if I'm with my family, they don't know about it. I'm doing it secretly, right? So I can't speak in front of them. So they will tell something different. So because of these things, it's always good for a doctor to do the assessment themselves to be sure that literally what. Okay. Now about the early warning signs. So the early warning signs would be recurrent oral ulcers, morning cough, irritability, increasing frequency of urine, breathlessness, and fatigue. As we know, the respiratory system gets affected the most. Definitely, you will see a lot of symptoms related to respiratory, right? So breathless common. Definitely, you make sure that you do the LFT test done, the lung function test done, and the rest of the blood test, which is needed. Even the X-ray, very important thing that you can do your diagnosis with would be the Fagerstrom test for nicotine dependence, FTND. You can also Google about it if you don't know. So there are six steps in this. You just need to do the assessment yourself in it. So this will actually make you understand where the patient stands, right? Then is the withdrawal scale, oral and lung screening, as we spoke about, right? And even if the oral ulcer is very commonly seen, then make sure that you also do the biopsy done. Management. So management is start again from Nidan Parivarjan, which is about knowing the cause and working on it, which would avoid triggers, gradually taper, and family support. Panchkarma and Upakarma, mainly in this, as we are seeing that the most important thing we need to focus would be the respiratory thing, right? The pranavaha strotas, right? So for that, I would suggest Dhumrapan can be used specifically, which Ayurveda has spoken about, using the herbs to do it completely into your respiratory channel. Okay. Along with that, you can also do Nasya with Anutel or Jyotishmati oil. Then Abhyanga and Swedan also really helps very well. Swedan is very much needed here because the detoxification is required, right? Nicotine gets into the body. So the best way would be do a gentle detox on a very regular basis. And nothing better than Swedan for it. The herbal steam, hot fermentation. Then is the Basti, which is going to help to stabilize Vata and support nerves. Uh, then are the Ayurvedic medicines and Rasayan, which is Guduchi, Khadiradi, Dhumari Churna. So there is a reference of this as well in the book. You can just check it. Dhumari Churna. Then Tulsi, Brahmiwati, Darshan Sanskar Rasayan, Trifla, Shatavari, Kapikachu, Ashwagandha. These all works very, very well. Let me tell you one more very important thing here, which is about the supportives. So the difference between the rest of addiction and tobacco, I always feel, is the very important thing being that the tobacco addiction people are having tobacco all the time in their mouth, right? The moment it gets over, they start have the craving again. So because we all know that the saliva that we have, we keep consuming it again and again. So just imagine that the tobacco is there all the time and the saliva gets mixed obviously with it. Every single moment the visher, the poison of of this tobacco keeps getting into the body, keeps entering the body every single moment, right? So just imagine that thing, usually I recommend my patients the umbelliferae herbs, which are the coriander, fennel, carom seeds. What you can do, you can ask them, or you can give it that a mixture of it in equal quantities, and ask them to have this before and after their meals specifically. Why? Because this is gonna ignite their digestive fire, okay, boost their digestion, and post that also. So because of that, again, at least it will start detoxifying their body a bit, right? So this is something that you can keep in your mind. Then one more thing which is very important specifically about tobacco addiction, one of the symptoms that has come up is the urine frequency, right? Which is a lot. So because of that, Mutra Sangrihaniya Gun is what I had given to my patient, and we had seen amazing result with it. And even I was astonished that only this one particular formulation of herbs, when the person is having tobacco, for example 5 grams, make sure that 4 grams is tobacco and 4 grams is of herbs, which is mentioned in Charak Samhita. So 1 gram is this. Then this combination, make sure that gradually you are increasing the combination, the herbs in it, right? 2 grams and 3 and 4. Tobacco, right? Make sure that it is done in under supervision of in Ayurveda doctor, and it will work very well. Then the Satvavajaya Chikitsa, the mental healing, which we know about, the cognitive behavioral therapy, meditation, yoga, mantra, pranayam. Pharmaceuticals being the nicotine replacement. This is also very important. Patch, gum, lozenges, inhaler. This is what can be used. Then buprenorphine, Nyloxyl are prescribed medicines. This is what usually the doctors usually recommend. Next is, as we all know, the lifestyle and preventive. Healthy diet, lifestyle, avoid pro-tobacco environments, strong family and community support. The long-term effects, as we all know, is the oral cancer, the respiratory issue, COPD, cardiovascular disease, infertility, immune decline, chronic physiological distress. Evidence shows that, study shows that the support of Panchkarma, Rasayan, and counseling has helped a lot of the tobacco addictive patients to reduce their cravings and better oral and respiratory health and relapse prevention. We all know about Hrithik Roshan, about his smoking journey. And finally, I'm glad that he's quit. And this itself highlights lifestyle discipline, yoga, and mindfulness in recovery. Next. Now, the last one, which is something which is spread all across the globe and we are very pretty much aware of, is the drugs addiction and Ayurveda. So, compulsive use of psychoactive substances despite harm causing physical, mental, and social disruption, right? Categories as well, because we need to know that how does it actually act and how do you help accordingly, right? So the categories are sedatives, depressants, methadone, benzodiazepine, psilocybin, cannabis, MDMA. They alter perception, and others are to actually give the treatment. Neurological basis drugs. These drugs, what do? They do actually? They hijack brain reward pathways, dopamine. You can see mania symptoms in it. Mania again has two categories. One is the psychosis and one is the neurosis. see people and we feel maybe the person, uh, I mean, it's not there, right? It's not there in pictures, but we see it in real. So, and because they are seeing that in real, they are not in actual reality where we are, right? Then the second thing is awareness, which is awareness of harm, but inability to resist. So this is where you know that you're not doing correct, but you're not able to stop yourself. Even let me tell you, it's not about ADHD or something, but even OCD is something which is commonly seen, which is obsessive compulsive disorder. Though the patient knows that I am doing this 10 times, for example, I'm using like 20 liters of water to then the Ayurvedic perspective for drugs addiction. It is next slide if possible. It is the Vata aggravation, nervous instability, AMA accumulation, the toxins which are accumulated, the metabolic toxins, inflammation, declined, state of it. Then, because of this, is the emotional fragility. This again leads to the intellectual error, repeated indulgence due to intellectual error, right? Then early warning signs. So mood swings, anxiety, irritability, secretive or risky behavior. So they always see that if somebody are doing something which is not accepted by the society, which they know about somewhere, so you will always see that secretive behavior, because they are not in that state itself to be responsible, honestly. So rather than telling them or the family telling them, I feel understanding is much more important at that place. Then social withdrawal, sleep or appetite changes. Once use scales that to be sure that how much which, when, how frequently. Toxicology test can be done to make sure that, where do the person stand. Then psychiatric assessment is also necessary. But that there is one thing which I would highlight um, uh, is the Panchkarma therapy, right? Wherein a hot stick specifically to be done on the marma points, the Shankha first, then the Sthapani, ear, the temporal area, and the Sakti, meaning the limbs, the thighs, in middle of that. So this has shown something like the shock therapy, right? Why shock therapy was done before the Trasan Chikitsa? Because when you want to balance the state of the Vata, which is actually aggravated and it's to the next level, you are not able to control at all with the medicines, how much ever you are doing. You can focus on doing this Panchkarma, the Agni Karma. This will definitely immediately work as a shock treatment and it will balance the state of mind and they'll be able to have some clear thought process. Herbal medicines are Tagar, Sarpagandha, Vacha, Kushmandavleha, white Gokarna with rock sugar also works very, very well, especially for morphine and cocaine. Then there is a formulation known as for Sangnya. So Sangnya Sthapan Gana. So this is basically for reviving the senses. Uh, the drugs actually affects the most is the Panchendriya, right? The Karmendriya as well. So the five senses. So if you want to bring back the senses, then the Sangnya Sthapan Gun is very, very recommended. Then is the behavioral and mind-body therapies. Um, which we know about yoga, meditation, and everything. Then is the diet and lifestyle, which we've spoken about. Then next slide, drugs addiction and Ayurveda. One more thing, pharmaceutical support is bupropion wherein is clean nicotine replacement integrated with Ayurvedic care. The long-term effects which we might see is organ failure, cognitive and emotional decline, social dysfunction, chronic stress, neurological damage, brain fog, attention deficit, circadian disruption, neuroinflammation, chronic fatigue, and behavioral dysregulation. Evidence is there for Panchkarma, Rasayana, and Satvavajaya Chikitsa, which is mental healing. It helps to restore mental faculties, reduce cravings, and improve systematic health. Real life example we know about is Russell Brand. He overcame opioid and stimulant addiction via mindfulness, psychotherapy, yoga, and lifestyle overhaul. Next. So today I tried to take a very huge topic. I wanted to cover up everything, and I wanted it to be actually people can use for themselves or for their family members or for their patients or whosoever it is. So I would love to close it here by saying that addiction is complex, but it is treatable. Mind you, that it is really treatable. Then integrating Ayurveda with modern therapies, it restores mind body's balance, sattva, the intellect and willpower. I would love everybody to follow me on Vishwacare on my social platforms for updates and guidance. And if anybody has any kind of queries, even after this webinar, please feel free to reach out to me. Maybe a student, maybe doctor. I am open to help everybody because I feel that is what my life purpose is here. Being a doctor to be of help to our entire society, specifically focusing a lot on the youth right now because that is the future generation, right? That is the base of everything. So I really would request everybody to focus on that as well. And just to let you know that we provide support for clinical practice, therapy protocols, and patient education. We also conduct webinars, workshops, and wellness retreat. Uh, I'm going out of my comfort zone, to help people. And because virtually I feel is not sufficient enough. So as you saw, I traveled to South Korea last year, and this year I'm going to Sri Lanka, and I am, connecting with a lot of people to spread the wisdom of Ayurveda all across the globe. Together, we can prevent and treat addiction, creating a healthier society. So, if you need any kind of Rotary help, please feel free to reach out to us. We are there on Instagram as well, Rotary underscore recap. You can please text us there if you need any help. And I would love to end it here saying Jai Bharat, Jai Ayurved, Jai Seva. Thank you, everybody.
Thanks a lot, Dr. Jaina. So thank you so much, Dr. Jaina, for that insightful and enriching presentation. Your expertise and knowledge have helped us with a deeper understanding of how Vimukti, freedom from addiction, with Ayurveda can be helpful to all the doctors present here. So before we conclude, I would like to open the floor for any questions. Please feel free to raise your hand or type your question in the chat box and Dr. Jaina will address them. The Q&A shall be hosted and managed by Dr. Snehal Makwana.
Thank you, Anand. I'm sorry, very sorry, ma'am, for the fluctuation in the internet, and there was a lag in the slides because I was not
No
able to
problem.
hear
I
you
understand.
completely. Sorry for that, and literally a need of an hour lecture because, as you rightly said, substance abuse we can quantify, we can know how much the alcohol is going, how much the drug is going, but behavioral addiction, which is becoming a new behavior now, new normal, food addictions or social media addictions or internet addiction is so much in now, and it looks like it is a normal behavior now, and you cannot quantify it, so it is
Your
really a
voice is
need
not
and a,
very clear, Dr. Sneh.
yes.
Correct, correct. Yes,
So this
agreed.
was a very good insightful lecture, ma'am. uh, let's move on to the question answer now. The first question is from Dr. Hima Nanavati. Milk and alcohol will become a viruddha anna, then basti of such will not cause any drastic change in GIT microbiome or any side effect
No,
of combo basti.
No, so basically it does not it is not working in that way at all. And this kind of thing also that I spoke about is only in those cases wherein the person is not at all able to help, right? So the withdrawal symptoms are very much seen if you stop it immediately. So again, one more thing good this point is told about, I missed speaking about it before earlier, that even though you are helping any patient with any kind of addiction, make sure that it is not done instantly, immediately, that from tomorrow stop doing it. No, that doesn't happen. The body also, the system also can't take it. So it's always a very slow and gradual process, right? So in that process, after month or 2 or 3, if you feel there is no change at all, no nothing, the person is not able to leave though, that is where you introduce this kind of basti therapy, which then only there's a possibility, right? As in, see, alcohol is going through somewhere or the else. It's going in a much more larger quantity. So might as well, when it is getting into the basti in a very small quantity, it gets absorbed immediately in the body through the intestines, and then the requirement of the alcohol starts getting diminished. Problem at all. We have tried this, we have tested it, and it is having no kind of side effects as well.
Dr. Snail, I think you're on mute.
Yeah, sorry. So next question is from Dr. Gauri. How to work on patients in withdrawal symptoms? Already they are not in condition to listen to anything or us. So how to work on those patients?
100% agreed. So that's the reason I told the fourth and foremost is not to be a doctor to them, just be a friend to them, counsel them, understand the problem, and start gradually. See, very frankly, very important thing is that if you want to leave one habit, you have to develop the another one, because that void is there, right? So rather than leaving that, the first and foremost thing what we need to tell is develop the healthy lifestyle, a healthy habit in the routine, gradually, step by step, not overnight, right? So as they start, actually seeing another space altogether for them, and they start feeling happy there, their dependence already starts coming down gradually. So I feel this would help, counseling and helping them structure their daily routine and a lifestyle.
Thank you, ma'am.
And
Dr. Snail, your voice
yeah,
is on mute, looks like again.
Okay. So I feel that gradual transition is required, right? From the
yes,
old habits to the new habit.
correct.
Okay. Uh, if
Yes.
anyone has any question, they can raise your hand. Uh, you can put it in the chat box. So Dr. Ma'am can reply to it. Okay, no more questions, man, right now. Coincidentally, my latest podcast was on same mobile addiction, and today is your same lecture, and so many things are common. Yes.
Oh,
Next question is Dr. Priyanka. Hello, ma'am. Now, many patients have diabetes and hypertension comorbidities. In such patient, how to use Arist Arista, I guess, and how long we have to use? Uh, Dr. Priyanka, if you can unmute yourself and ask the question, because this word
your
Aristra
voice is
is
not very
uh,
audible.
is my voice clear, Anand?
Yeah, Dr. Snail, I've allowed mic for Dr. Priyanka.
Yes, Dr. Priyanka, you can unmute yourself and you can ask your question
Dr.
directly.
Priyanka, please go ahead.
Hello,
Yes,
am I
Dr. Priyanka,
audible?
we can hear you. Yes, ma'am.
Okay. Good evening, ma'am.
Yes,
Hello.
Dr. Priyanka. Yes, ma'am. Please go
Okay.
ahead.
So as we can see, many patients have diabetes, hypertension. In that case, how we can use Asav, Arishta, and Avleha, like you have mentioned Kushmanda Avleha, right? So how we can use or apply them, or in which dose and for how long period?
Your voice is not very clear. Mr. Anand, can you please
Ma'am, yes, ma'am.
let me
Ma'am,
know
can you
about the
hear me clearly? Yes. Ma'am, are you able to hear me?
Your voice is clear, Anand, for me at least.
Okay, so I'll just repeat the question. Dr. Priyanka has asked this question that
Yes.
now many patients have diabetes and hypertension comorbidities. In such patients, how to use Arishta, Aso Arishta, and how long do we have to use this? Ma'am, did you get me? Or even my voice was breaking? I'm really sorry. We have a lot of internet issues today. Ma'am, I'll just message you the question.
Just give me a sec. Yeah, you're audible now. Please tell me.
Yes,
Ma'am,
I
I will
will repeat the
just
question.
WhatsApp.
Yeah, can you?
I've just sent the question in a WhatsApp. Ma'am.
Sorry, I don't know. Some problem with my internet.
It's okay.
Okay, thank you. Am I audible to everybody?
Yes, ma'am. Ma'am, I can hear you clearly. Ma'am, I've also WhatsApp you the
Yes.
question. Yes,
So
ma'am.
yes, diabetes. Okay. So yes, for diabetes. So obviously, not just Asa Barishta, but I would say that, see, being a doctor, obviously, we are not just to treat one thing, right? We need to first analyze, assess, doing the Nadi Parikshan, Prakriti Parikshan, knowing the age, the place, everything, and knowing what actually are the health problems. And accordingly, we need to treat them overall, not just one thing at that moment. So, yes, it can be used, the Asavarishta, depending on, again, like what is the Prakriti, right? So it is a customized medicine, as I told. Like, do you need to use Lodrasav if it's a diabetes patient and you feel the rest of the things also is okay then? So I feel it is right. But along with this, you definitely need to add on your actual medicines for that particular comorbidity or health issue. And how much time to take medicine? I feel any kind of addiction case, it takes a bare minimum of 3 months to start seeing. Months is as in bare minimum.
Okay. Okay. Uh, Anand, as I can see, there are no more questions in the chat box. So you can close the session.
Yeah, thanks a lot, Dr. Jaina. So thank you everyone for your active participation. We are closing the Q&A now. Thanks to everyone for active participation and your engaging questions. We hope you found this session very valuable and informative. Once again, a big thanks to Dr. Jaina Patwa for sharing her expertise with us today, and thanks to all the participants for joining us. We look forward to seeing you all in our next Gyaan Vardhini session, which is scheduled on 29th of October to be conducted by Vaidya scientist Namyata Pathak. The topic is From Doctors to Vaidyas, Surfacing Compassion-Based Ayurveda. I've also put in our spam-free Gyaan Vardhini WhatsApp community group links and the YouTube links in the chat box. Please use this for your purpose. And again, thanks to everybody for the session today and to Dr. Jaina as well. So we are going to close the session now. Have a wonderful evening. Thank
Thank you,
you and bye.
everybody.
Thank you.
Thank you.